Hi, everyone. Welcome to Group 4's Ethical Case Scenario. So, our scenario involved an adolescent who had been coming to our practice since infancy. So, today she came in with her mom. She had had nausea, vomiting, and abdominal pain. So, the mom talked to us alone and said that she had not been acting herself lately in reference to her daughter. We look at her, we talk to Alexandria, and we ask her if she's being sexually active. She tells us that she is having unprotected sex with her boyfriend. She doesn't keep track of her periods. When we do perform the pregnancy test, it comes back positive. We let the patient know and ask her if we can talk to her mom about it, and she adamantly says no. We do encourage her to talk to her mom and say that she should make an appointment with an OBGYN. They leave. Mom calls us back later and asks what's going on. And that's our dilemma. So, in this scenario, we have a couple of things that we're presented with. We have an adolescent who wants confidentiality between the provider and herself. She wants to be able to make decisions on her own, maybe not have the emotional maturity that she should. And then we have the issue of breaking that confidentiality between ourselves as providers and an adolescent patient. So, as a provider, you have the duty to respect the wishes of your patient regarding confidentiality, and you also have the responsibility to do no harm and to advocate for your patient in the case of young women who are pregnant. According to the AMA Journal of Ethics, teen pregnancy and confidentiality poses a special problem due to the emotional maturity and decision making capacity of the patient. The provider is responsible to consider the lives of both the patient and the unborn child. A teen who is afraid of talking to her parent suggests that there's a maturity issue, and you have to consider that when this teen will soon be the responsible party for a newborn child. The provider must also consider all the facts and move forward to address the issue, and they can't just ignore the issue. The Texas Department of Health and Safety talks about this time frame in our adolescent stage coming from childhood into adulthood, and that they develop new healthcare needs and concerns at the same time that they're gaining autonomy from their parents. And so as this progression ensues, they also want to become more involved in their healthcare needs and become more independent from their parents in making decisions in regard to their healthcare. In this scenario, we see four ethical principles that just stand out. Um, we have autonomy, beneficence, non-maleficence, and fidelity. As nurse providers, we help the patient achieve autonomy by respecting Alexandra's right to self-determination. It's our position to support her independent decision making. If the patient doesn't want to speak to her mom about this issue, you can't break the confidence. The principle of beneficence is portrayed by the nurse who shows compassion, the desire to do good and to help your patient. Non maleficence is the avoidance of harm. At this point in time, by breaking a patient's confidence, we might harm the patient's emotional state. So, as a provider, we must not break her confidence, but must find a way to help this young lady make the best choices that she can, given the support system and resources that she has. Principle of fidelity is portrayed by remaining loyal to our patient, being truthful, dedicated, and an advocate for our patient. Since this is an issue that affects the lives of multiple people, including the unborn child, we must work diligently at finding a solution to getting the best care for the patient. This probably includes visiting with the patient and really encouraging her and educating her to make some very hard decisions at this age. And if we show fidelity and work toward a solution in conjunction with the patient, typically our results will be positive in our patient care. So, overall, what we decided is that this was a super tricky situation where many states have different laws as far as minors consenting to medical treatment. So, we felt that we should all definitely be well versed in our state's emancipation laws, being that the patient is 16 years of age. Once we know that and are comfortable with that, then if our patient who at 16 and pregnant is covered under the emancipation law, then we have a duty not to talk to the mother due to HIPAA. We would want to follow the patient wishes and not break HIPAA by talking to the mom. We also would want to encourage the patient to talk to her mom so that she has a good support system. Or if she doesn't want to talk to her, if she's nervous, if she would allow us to talk to the mom about the situation. And then finally, we also want to attempt to make the patient feel as comfortable as possible and encourage her to talk to her mom because she will need support in this situation. If the patient still didn't want us to talk to her mom, then we would educate the patient and with all of the resources and support systems available to her at this time. Of note, we talked about several pregnancy preparedness programs throughout the different states that we are in, like Children First, Healthy Families, of course, the health departments in the states, and looking into finding an OBGYN. Oklahoma offers a program called Children First, where a nurse comes into the home and they essentially take care of the patient throughout the pregnancy. And they stay in contact with the primary care provider, especially if there's any kind of complications or abnormalities that they're noting. And then once the baby is born, the RN is there, the same RN, to take care of the baby initially, and then talk to the primary care provider if there's any deviation in the health status of the infant or the mom. It's a really neat program. So, what are some of the consequences that we see that could happen in this scenario? Number one, if we talk to the mom without the patient's consent, then we've breached HIPAA. And with that, there are potential penalties, not even potential, there are penalties if we break HIPAA and are found guilty. Monetary, practice penalties, all of those that we are well versed in the healthcare population. We also might lose our patient. This patient might never trust us again if we breach that confidentiality. We also are overstepping our boundaries as a provider in the sense that we know that really it's not our right to talk to the mom without the patient's consent or presence. And then, of course, this patient being an adolescent, she's a 16-year-old girl, she talks a lot, right? So, with that, word of mouth is key to a lot of practice. And if somebody is telling, hey, this provider is not very good. Broke confidentiality. It can have a very detrimental effect on our practice. Also, of note, when dealing with a situation with adolescents who are sexually active, we also have to be aware of our state laws in regards to what is considered mandatory reporting. So that's another kind of caveat to this scenario that we've got to consider if her boyfriend, if it's an okay sexual activity. Because if it's not, in reality, none of the rest of this matters if we're not taking care of our patient and being an advocate and reporting when reporting is required. And so we just want to be sure that we're all apprised of our state laws in regards to sexual activity amongst adolescents. Thank you all for listening.